Wabash Valley Alliance celebrated its 80th anniversary tonight. The company says it was time to make sweeping changes, and this included the inaugural Valley Summit for Mental Health.
On the precipice of our 80th anniversary, we're making some big and exciting changes. We're going to be taking a more active role in the future of our communities. We're establishing the Valley Summit as a brand committed to a sea of change, with eventually having workshops, working groups, and constant communications. We'll be working more closely with schools and government to provide education on mental health, and we'll be stepping out from behind the tree. It's time to make a change. It's time to address stigma and step out in front of it. To let people know that it's okay to get help for mental health and addictions issues.
Wabash Valley has a lot going for it. It has a legacy worth being proud of. It has a presence in each of the 10 counties it serves. It has dedicated leadership and board members with inspiring plans for the future. I see a future where Wabash Valley is viewed as a welcome and expected member of the community, not only in the clinic, but also at the county fair. I see a future where a person with a broken home, a broken heart, or a broken hope is treated with the same speed and respect as someone with a broken leg.
I think the most important part is educating the community and bringing people together. Addiction, it hides in darkness.
Austin Eubanks is talking about mental health. He's a survivor of Columbine and a recovering addict. Eubanks was shot in the library along with his fellow classmates. He says he was in complete shock.
Because when I came home from the hospital after Columbine, I had an opiate prescription, a benzo prescription, and a stimulant at home. You see, I think that this is one of the biggest errors that we still see today, is the lack of collaboration that we have in treatment plans, in healthcare plans, specifically between physical health and mental health. Drugs are more toxic and more deadly than they have ever been before in history, and they are more accessible today despite a 30-year war on drugs. That is why these conversations are so crucial with whoever you can reach that will listen. That's why increasing accessibility to services for people who need it is essential. And not only that, transforming communities to focus on prevention, to eradicate these problems from future generations.
To make finding the door to Wabash Valley Alliance easier, the company is debuting all new signage. It wants to be more visible and offer more educational services. It echoes exactly what Eubanks says.
Addiction doesn't discriminate based upon race, socioeconomic status, religion. It doesn't matter. It can affect any of us. And when we live in a culture that is ill-equipped to address emotional pain, that is becoming more and more fragmented every month that passes, these things are allowed to fester. And that is where I apply everything that I have in my power today, is to expanding models that increase the accessibility to treatment, that focus on prevention, that can eradicate these issues from future generations. We have to start focusing on preventative efforts. We have to educate youth to be able to have higher level conversations about how they're impacted by adverse childhood experiences, so they can make decisions about how these things are going to play a role in their lives, knowing that it's going to transform who they are as a person. The blessings of recovery are immense, and they're available to anyone. It's our responsibility to make sure that they have a chance.